Apple Watch to be used to detect heart rhythm irregularity in seniors. On February 25, Johnson & Johnson and Apple announced that they will be collaborating on a study to determine if the Apple Watch can detect atrial fibrillation among seniors. Atrial fibrillation is a heart rhythm irregularity that can increase one's risk of stroke. The study will be focusing on older people because those 65 years old and older are more prone to the condition than those who are younger. The two companies will also determine if the Apple Watch can encourage seniors who may have atrial fibrillation to meet with their physicians. The study will reportedly be the largest randomized trial on cardiovascular disease. The researchers plan to recruit around 150,000 people to divide into two groups. The first will use an educational iPhone app for health named Heartline. The second will use an Apple Watch, which will be loaned or discounted at $49 with added tax. An Apple Watch Series 5 currently costs $399, a price many of the 150,000 recruits may not be able to pay. Those who use Heartline will be reminded to take their medication and may even be rewarded with cash. The app is also linked to Medicare's Blue Button API, allowing users to access information on their insurance bills and claims. Apple and Johnson & Johnson will be partnering with a startup named Evidation Health to complete the research, which may take 3 years to publish. The study may allow seniors to live an independent life longer than normal and call emergency services when necessary. They have said that they will still publish the study if the results are unsuccessful. Atrial fibrillation occurs when the atria, the heart stop chambers, give off electrical impulses in a disorganized way. The atria may then twitch, and this is called fibrillation, causing a fast or irregular heartbeat. Someone with atrial fibrillation may experience palpitations, a shortness of breath, dizziness, and tiredness. Sometimes they don't experience any symptoms at all. Atrial fibrillation has no known cause, but it is known to occur in people with other conditions like congenital heart disease, diabetes, and coronary heart disease, among others. If a patient is diagnosed with atrial fibrillation without any pre-existing conditions, it is known as lone atrial fibrillation. One can determine if they may need to see a doctor by feeling their pulse at their wrist. The doctor may then ask for a series of tests, including blood tests, a chest X-ray, electrocardiogram, and echocardiogram. The main goal of treatment is controlling the rate and rhythm of the heart with a pacemaker or medication. If left untreated, atrial fibrillation could cause a blood clot to form inside the heart and travel to the brain, leading to a stroke. Most people with atrial fibrillation are prescribed blood thinners to reduce the risk of stroke. They also need to be physically active, stay away from cigarettes and alcohol, and eat healthily. Though atrial fibrillation may sound frightening and can be a challenge for patients and their families, it is possible to live a happy life with the condition.